Hey there, Kim Loh here again. Today we're going to dive into a topic that needs some serious clarification. Colorectal cancer myth. Colorectal cancer, which includes cancer of colon and rectum. Here are 5 common colorectal myths we are going to debunk today. Myth number 1. Colorectal cancer only affects older adults. Do you know how people used to think that colorectal cancer was something only older folks had to worry about? Well, it turned out that belief isn't quite accurate. Colorectal cancer is actually become more common among young adults these days. In 2019, nearly 20% of cases were found in people under 55. That's twice as many in 1995. This change is a big deal because it means that colorectal cancer does not discriminate by age. It can affect anyone, whether they are young or old. That's why it's crucial for everyone, regardless of their age, to be aware of this and take steps to prevent it. You can do things like maintaining a healthy lifestyle, being on the outlook of any signs that something might be wrong. You can do things like maintaining a healthy lifestyle, being on the outlook for any sign that something might be wrong, and making sure you get regular checkups with your doctor. So, let's move past the idea that only older people are at risk of colorectal cancer. And remember, that is something we should all pay attention to and take action against. Myth number 2. Colonoscopy is a deathful experience. Do you believe that colonoscopy is a scary and terrible thing? Well, let's take a closer look. Think of it as a kind of medical checkup. That's a bit like a peaceful nap mixed with a dose of prevention. And here's the good news. Thanks to better technology and anesthesia, the stuff that make you not feel pain, it's not as bad as some people might say. In fact, most folks who have a colonoscopy wake up and wondering why they were worried. It's a bit like expecting a big scary storm and then feeling a gentle breeze instead. It's not painful, and you usually don't remember much because you are sleeping during it. But why a colonoscopy important? Well, it's a way for doctors to check your colon for any problems. They use a tiny camera on the end of a thin tube to look inside. This can help catch and prevent serious issues like colon cancer. So, don't let the idea of colonoscopy scare off you. It's a helpful and pretty easy procedure that you can keep you healthy. If your doctor recommends it, you might just find it not as deathful as you thought. Myth number 3. Colorectal cancer is always deathful. Have you ever been taught that if someone gets colorectal cancer, it's always a sure way to a very sad ending? Well, let's set the record straight. Colorectal cancer isn't always a sentence for a bad outcome. In fact, there's a hope, and here's the why. It's a bit like when you carry an umbrella on a cloudy day. You see, the key is catching colorectal cancer early. When it's discovered in its early stages, there's a much better chance of getting rid of it and having a good outcome. Imagine this, your body is like a garden, and colorectal cancer is like a weed. If you spot the weed when it's small and remove it early, your garden can stay healthy. That's why early detection does. It helps find and remove the cancer before it can cause big problems. Why colorectal cancer isn't always deadly? First, with early detection, detecting colorectal cancer early makes it highly treatable and even curable. Regular screening are the key to early detection. Second, advance in treatment. Advance in medical treatments have significantly improved survival rates for colorectal cancer patients. Preventive measures. You can lower your risk of colorectal cancer by adopting a healthy lifestyle and undergoing regular screening as recommended by your healthcare provider. Fourth, awareness. Greater awareness about colorectal cancer leads to more people seeking help and getting screened. Awareness can save lives. Fifth, personalized care. Treatment plans for colorectal cancer can be tailored to each person's unique situation, ensuring the best possible outcomes. Colorectal cancer is a serious thing, but it's not always deadly. With early detection, appropriate treatment and preventive measures, you can improve your chance of staying healthy. So don't let the myth of being always deadly get you down. There's a lot you can do to protect your health and well-being. Myth number 4. Only those with symptoms need screening. Have you ever thought that you only need to get screened for colorectal cancer if you have symptoms like stomach pain or bleeding? Well, it's time to clear that up. Relying solely on symptoms is like waiting for thunder before you grab an umbrella. It's not the best approach. Here's why. Imagine this. Your body is like a car, and colorectal cancer is a hidden problem under the hood. Sometimes, this problem doesn't make any noise or show any signs until it's too late. That's why screening is necessary for everyone, whether you feel okay or not. Why screening is important for everyone? First, hidden dangers. Most colorectal cancer cases don't give any warning signs until they have become serious. Screening can catch these problems early, when they are easier to fix. Second, better chance. Finding and treating colorectal cancers earlier can increase your chance to get better. It's like fixing your car when you hear a small rattle instead of waiting for it to break down. Third, preventing problems. Some screening tests can even find and remove growth in the colon before they can turn into cancer. It's like fixing a leak in your roof before it causes a big mess. So, don't wait for symptoms to show up before thinking about colorectal cancer. Get screened regularly, even if you feel perfectly fine. It's like carrying an umbrella, even on clear days. You are preparing for whatever comes your way, and that's a smart way to stay healthy. Myth number 5. Only those with family history are at risk. Have you ever thought that the only people who can get colorectal cancer are those who have a family history of it? Well, let's put the record straight. Believing you are safe from colorectal cancer just because it's not in your family. It's like thinking a certain place gets rain, when in the reality, rain can fall anywhere at any time. Here's why the myth doesn't hold water. Imagine your body is like a house, and colorectal cancer is like an unexpected visitor. Yes, if someone in your family had that visitor before, you might be more worried about it happening to you. But guess what? Most of the time, this unwelcome guest show up in your house with no family history of it. Why colorectal cancer can affect anyone? First, surprising appearance. The majority of colorectal cancer patients don't have a family history of disease. It can sneak into your life whether your relative had it or not. Second, another risk factors. There are other things that can increase your risk, like your diet, lifestyle, or how old are you. It's a bit like different places having various weather patterns. Rains can happen in unexpected spots. Third, being prepared. Even if it's never rained in your area, you might still carry an umbrella just in case. Similarly, anyone should take steps to prevent colorectal cancer, like getting screened and living a healthier life. So, don't assume you are immune to colorectal cancer just because you are not in your family history. It can show up unexpectedly in anyone's life. In conclusion, colorectal cancer is a type of cancer that affects the colon and rectum and have various causes and symptoms. Colorectal cancer can present various symptoms. It is important to note that many of these symptoms can also be caused by others, less serious conditions. If you experience any of symptoms, it is advised to consult a healthcare professional for a proper evaluation and diagnosis. Symptoms of colorectal cancer may include change in bowel habits, persistent diarrhea or constipation, or a change in consistency of stool, such as narrower stools than usual, blood in stool, rapid bleeding or blood in stool, which can appear as bright light or very dark, abdominal discomfort, cramp, pain or discomfort in the abdomen include bloating and gas, unexplained weight loss, a significant and unexplained drop in weight, fatigue, ongoing tiredness and weakness, incomplete evacuation, feeling like you need to have a bowel movement but not being able to fully empty your bowel. Iron deficiency anemia, low level of blood level cells due to chronic breathing, which can lead to fatigue. Nausea or vomiting. These symptoms may occur if there's a blockage in the colon. Jaundice, yellowing of the skin and eyes, which may indicate the cancer has spread to the liver. Unexplained pain. If the cancer has spread, it may cause pain in other areas of the body. It's important to stress that many people of colorectal cancer do not have experienced any symptoms in the early stages. Therefore, regular screenings such as colonoscopy are essential for detecting the disease at an earlier and more treatable stage, especially for individuals at high risk such as those with family history of colorectal cancer or certain genetic conditions. Screening can often detect precancerous growth that can be removed before they develop into cancer. If you have concern about colorectal cancer or any related symptoms, please consult a healthcare professional for guidance and appropriate screening. Maintaining good health and reducing the risk of colorectal cancer involves making positive lifestyle choices to support your body's overall well-being. Think of your body's defense, like the immune system, as your personal army. Your daily choices can either strengthen or weaken this army. Healthy habits such as staying active, getting enough sleep, eating a balanced diet, and avoiding harmful behavior like smoking and excessive alcohol consumption can help bolster your defense against colorectal cancer and other diseases. Before you go, thank you for joining me today. Let's grow our wisdom on Kim Loh channel. Before we wrap up, hit that like button, hit subscribe, and share this eyes-opening information with your friends and family. Let's break down this myth and empower each other with knowledge. Until next time, stay informed, stay proactive, and keep spreading awareness.